Hello, I'm Dr. Rochet, and in this video, we're talking about pediatric chiropractic care, what it really is, and why it might be a helpful part of your child's healthcare journey. Now, one of the common questions we hear is chiropractic safe for babies? And the resounding answer is yes. Okay, research and professional guidelines show that pediatric chiropractic care is safe. Unlike what many people think, pediatric chiropractic is not about back cracking. By using a gentle, constant pressure technique, about the same amount of pressure you would apply to touching your eyelid, we are able to correct spinal subluxations and ensure that baby's nervous system is calm, allowing the baby to grow and develop in a healthy fashion. Another question we get is, well, why does the baby need to be adjusted? It doesn't have back pain or a headache. Chiropractic care is about function. It's not about feeling. And a vaginal birth is a stressful event for both mother and child. These physical stresses oftentimes produce misalignments in the baby's spine, affecting how the brain and the body communicate. And these subluxations are most commonly in the upper cervical area, C1 and C2. Now, a baby can't tell you that its nervous system is interfered with, and it can't tell you that a bone in its neck is misaligned. The most common effects of spinal subluxations in children are ear infections, colic, difficulty or inability to latch to feed, torticollis, sleep interruptions, and ineffective tummy time. These are all indications of spinal and neurological stress. And the likelihood of subluxations of the spine are increased during C-sections or other doctor-assisted births where forceps and vacuum are used. Now, studies suggest birth trauma, injury to the upper neck during childbirth, to be a prime factor in SIDS. Studies have shown links between high cervical spine function and reduction in the risks related to SIDS, highlighting how gentle chiropractic care can support infants' autonomic regulation, enhancing nervous system function, meaning they're functioning well. Now, that's all the scientific stuff. How about the real life application? The parents in our office, myself included, tell us that 5 main benefits come from chiropractic care. Their kids are sleeping better, they're reaching their milestones easier and faster, no issues with digestion or constipation, they have immune system resiliency, they don't get sick as frequently, or their illnesses don't last as long and are never as severe, and finally, their kids show better posture, balance, coordination, and motor skill development. You can imagine the peace and comfort a new parent can feel knowing their new child is showing signs of vitality and thriving versus the stress of seeing their new baby struggle and not know how to best help them. If you have a newborn or a young child, I want to encourage you to talk to a chiropractor with pediatric experience or find one on the ICPA website in your area who can answer your questions and design a safe, gentle plan just for your family. Having your kids checked and adjusted early is the most effective way to ensuring a healthy start to life.